Welcome to the Psycho Nurse. In today's video, we're diving deep into one of the most challenging aspects of nursing and healthcare, handling difficult patients. Whether you're a nurse, doctor, or anyone working closely with patients, you've probably encountered difficult situations in your practice. But how do you manage these situations with care, respect, and professionalism? Let's talk about it. First, let's acknowledge that difficult patients aren't always bad. There's often a reason behind their behavior. It could be pain, fear, anxiety, or frustration with their treatment. Remember, for many patients, being in the hospital or a healthcare facility can be a highly emotional and distressing experience. Some patients lash out because they feel powerless or out of control in a situation where their health is at risk. Others might have underlying mental health conditions that affect their behavior. And in some cases, they may have physical conditions, like dementia or delirium, that impact their responses. Now that we understand why patients may become difficult, let's discuss how to approach these situations. Here are 5 techniques that can help you manage difficult behavior in a compassionate way. Active listening is key. Give your patients the space to express their concerns. Sometimes all they need is for someone to listen to them. Show empathy and validate their feelings. Acknowledge that you understand their pain or frustration. For example, if a patient is frustrated about waiting for care, simply saying, "I understand how frustrating it is to wait," can make them feel heard and understood. Dealing with a difficult patient can be stressful, but maintaining a calm demeanor can help diffuse a tense situation. Patients often take their cues from you. If you stay calm, they're more likely to mirror that energy. Remain professional, even if the situation gets heated. If you feel yourself getting frustrated or emotional, take a deep breath. It's okay to step away for a moment if needed, but always return to the situation with a calm approach. Setting boundaries is essential in healthcare. If a patient is being verbally aggressive or disrespectful, it's important to communicate clearly about what behavior is acceptable and what isn't. Let them know that you're there to help, but mutual respect is key. You could say something like, I'm here to assist you, but I need us to have a respectful conversation in order to work together. Setting clear and respectful boundaries can help patients understand that they are not entitled to disrespect, but you're still there to support them. Whenever possible, work with the patient to find solutions. If they're upset about something, like a delay in treatment or a procedure, involve them in the conversation. Ask what their concerns are and offer possible solutions. Collaboration helps patients feel empowered, and it often makes them more cooperative in the long run. What would make you feel more comfortable with this? Is a great way to encourage engagement from the patient. And finally, know when to ask for help. There are times when a patient's behavior may be too much for one person to handle, especially if it's escalating to the point of aggression. In those situations, don't hesitate to ask for backup from security supervisors or other healthcare team members. Your safety and the safety of your team are paramount. Never hesitate to involve others if you feel the situation could become dangerous. It's also important to remember that working with difficult patients can take a toll on your mental and emotional health. After all, you're not just caring for their physical needs, but you're also managing intense emotional situations. That's why self-care is essential. Make sure to take time for yourself. Practice relaxation techniques, talk to a fellow healthcare worker about your experiences, and don't be afraid to ask for support from your colleagues or supervisors when you need it. Remember, handling difficult patients doesn't mean tolerating disrespect or mistreatment. It means using your skills to create an environment of respect and care, no matter how challenging the situation might be. Thanks for watching The Psycho Nurse. Don't forget to like, subscribe, and hit the notification bell so you never miss an episode. And if you have any tips or experiences of your own with difficult patients, drop them in the comments below. We'd love to hear from you.